some of the side effects you can have from surgery. So the operation for prostate cancer is removal of the prostate gland. What they also do is they remove the seminal vesicles, okay, and they clip off the sperm cords, all right? So what that means is there's no more ejaculation fluid when you have an orgasm. So you should still be able to have a sensation of having an orgasm, but the ability to ejaculate is no longer there. So we call that a dry orgasm, okay? The seminal vesicles are removed. Also, sometimes they do a nerve sparing or a non-nerve sparing procedure. So the doctor will always try and spare the nerves that help with erectile function, but sometimes they can be a bit concerned about where the cancer's close to where the nerves are, and so they might take some of the nerves on one side or all of the nerves. If they take all the nerves, that's not a nerve sparing procedure, it's a non-nerve sparing procedure. The surgeon should discuss this with you before you have your operation. So that's an important thing to be aware of. If they haven't talked to you about it, make sure you do discuss it with them. Because the nerves responsible for erections lie so close to the prostate gland, even if they spare those nerves, they can be traumatised from the operation, okay? And normally you have about 4 to 6 erections on average every night when you're sleeping. They're called nocturnal erections, and we believe that they're there to keep the tissue in the penis healthy. So it's flushing oxygen-rich blood flow through the penile tissue to keep it healthy. When you have the operation, the nerves kind of go into a bit of a trauma or shock, and even just exposing them during surgery can have that happen. So that can take up to 2 years to see whether or not the nerves are going to recover. Okay, and in that time you might not be getting those regular nighttime erections to help keep the tissue in the penis healthy, and this can impact on your erectile function long term. So your ability to be able to get an erection when you want one can be impaired just because the nerves aren't functioning properly. Okay. Also, because when we do the operation we take out the prostate gland, some of your water pipe's actually taken out as well, and then they join your water pipe back up to the bladder, and there's a bit of a shortening of the penis from the surgery, which most men notice after the operation. So generally that happens to all men from having the operation. So shortening of the penis is a side effect from the operation. Men can suffer from having urine leakage when they're sexually aroused or when they orgasm after having the operation as well. So radiotherapy can impact on you differently for treatment compared to surgery. Often we find with surgery, you know, you have the side effects happen very early on and they may recover with time. Often with radiation, depending on the type of radiotherapy, you might not notice sexual side effects until a bit later down the track. So you can develop erectile dysfunction with nerve damage from radiotherapy, and you can also have problems with your orgasm ability as well. So some men can suffer from some painful orgasm as well. Hormone therapy is a treatment for patients. They can have that with radiotherapy to treat prostate cancer contained within the prostate, and sometimes hormone treatment is used for men who have prostate cancer that's gone outside of the prostate. And the hormone treatment really actually just sort of depletes or stops your body producing any testosterone. And you really need testosterone as your kind of male drive to be able to have arousal and be interested in sexual activity. So not surprisingly, a lot of men who have hormone treatment find that they're actually, they lose their libido. So this can have a big impact on them and also impact on their partner. And coming along with that is also some erectile dysfunction. So that's a common problem that happens for men who are on hormone treatment.